Not getting your health and wellness questions answered at your doctor's office? Are you ready to take control?
Hi guys,
Not
welcome
getting
to
your health and wellness
Realtime.
questions answered at your doctor's office? Are you ready to take control of your health and well-being? Do you want the proper tools to set you on your wellness journey? Do you want to meet and chat with expert members of the healthcare team? Well, step into Real Time with Dr. Stacy. Hi, I'm Dr. Stacy DeGale, your personal physiotherapist.
And guess what? We always must have some technical difficulty. I'm not going to blame B-Mobile or Digicel or Flow. But doesn't matter. We are here all together, and I'm so happy to welcome you again to Real Time with Dr. Stacy, our very first episode. And again, celebrating health, celebrating wellness. And we're on this journey together to get us to be healthier individuals, to be a healthier family, to be a healthier community. And because we're celebrating World Diabetes Day on the 14th of November, our first series of 5 episodes of Real Time with Dr. Stacy is all about living well with diabetes. And I am reminding us all that we have approximately 200,000 persons living with diabetes right here in Trinidad and Tobago. And we can do better. We can do better to prevent it, and we can do so much more to manage the disease so that we can live well, so that we can minimize the risk of blindness, stroke, kidney failure, amputations, just minimize the effect and burden of being diabetic on our families, the burden on our pockets, the burden on our psyches. So we are here today to start this journey, and I hope you have your pen, because I have mine. There's always something to learn. I have my paper because there'll be notes that we have to take, and this recording will be there for you to share with your family and friends, and for you to look at again, so that you can solidify all the information that we're going to try to get to you over the next 40 to 60 minutes. So I'm happy to see so many of us online already. And thank you, Priya. Hi, thank you for being here, for always giving your support to everything that's health and wellness. And Omar, it's a pleasure to have you all here. And I'm looking forward to seeing persons asking their questions, being not afraid to ask. This is the time to ask, because sometimes we don't have the ability to ask in the doctor's office. Hence the reason you're here. And if you can't, or a little shy to ask live, feel free to email us at backinmotiontt@yahoo.com. It's right there on your screen, so that you can get your questions answered as we serve to help us to live well with diabetes. So our first guest is someone whom I have known for quite a while. And I want to introduce you to Nurse Wendy Phillip. Nurse Phillip is a registered nurse and licensed midwife with over 30 years of experience, even though she looks nothing close to 30 years of experience. She, during her career, has had extensive experience in both the public and the private sector. And it is while working, however, in the public sector that she observed the debilitating effects of unhealthy lifestyles in Trinidad and Tobago. You know, lifestyles that cause persons to be admitted repeatedly, to have so many other complications. And this fueled her passion, therefore, to become more actively involved in helping persons live healthier lives. And that resulted in her not only being a nurse, not only being a midwife, not only being a mother, but she then pursued her bachelor's in human nutrition and dietetics, and then became a registered dietitian. And she soon after certified as a diabetes nurse educator. And so it is with great joy, great pride that I welcome Ms. Phillip, who has counseled so many persons in the workplace, in the home, in the church, to be here. Because when I asked, she was one of the first people that came to mind when I was organizing the show. And without hesitation, She said yes. So I would like us all to welcome Wendy Phillip, our RN midwife, and for this evening, our experts, our diabetes educator experts. So welcome, Ms. Phillip. Thank you so
Thank
much for
you.
being here.
Thank you so much.
And I'm not sure if you're seeing any comments, but of course, Arlette, your daughter is hailing you out online. She said, "Hey, my mommy, she's proud as she should be." And my brother is always here supporting me. Thanks, Steph, for being here. And for those online, don't forget, you still have time to share the feed. Let people know that they should be listening to this. This is something for every one of us because each
Yes.
one of us has a friend or a family member who has diabetes. So I don't want to be doing all the talking. I have the easy job. I have the easy job of just hosting this. But I want to ask, before we get into the nitty gritty, I want to ask you though, why a diabetes educator? Because when we think of healthcare in Trinidad and Tobago, we often think about the doctor. You always say, well, I have to go to the doctor. You have a pain in your toe, I have to go to the doctor. You have a pain in your back, I have to go to the doctor. I have a speech problem, I have to go to the doctor. But we forget that there are other members of the health team. There are physiotherapists, dietitians, occupational therapists, psychologists. There are nurses who form such a major, important role. But in your capacity as a diabetes educator, why? And why should someone with diabetes see a diabetes educator?
Thank you again, Stacy. Good night. Good evening, everyone. I am happy that Stacy invited me to be a part of a team in sharing diabetes. I became a diabetes educator, one, because of my profession. I have been involved in nursing patients with the debilitating effects of diabetes. A diabetes educator is not just a person who knows about the diabetes, but you also help people manage, self-manage, teach them how to cope, to deal with the condition of diabetes. You're educating the people, their families, their friends, the public, so that you now will be able to help them and they would be able to control and take total control of their life and their health.
And
So
I think that is something that is so important that you touched on there, Nurse Phillip, with regards to the patient taking control. I think so often when we are talking to patients about their conditions, we give them instructions and we
yes.
hope they follow it.
Mm-hmm.
But your role, especially as a diabetes educator, is to empower the patient to take control because they are the main member of that team.
That's true.
And this is why what do you think though? Because I know one or two of you exist. And maybe we need to have some more. I encourage all my diabetic patients to see a diabetes educator. And I don't know if you advocate for that or if someone who sees a diabetes educator must be somebody who is uncontrolled. Should every diabetic have at least one or two consultations with someone in your field?
I would think so. I believe so. And I hope so.
Yes. So
I
for
hope
all of you all who are listening, listen to what she's saying, and I'm sure she's going to give us her contact information after, because she's a source of information to empower you to take control of your diabetes.
Mhm.
So
Yes.
I want to hand over fully for a while to Nurse Phillip, our diabetes educator expert, because she's going to start the ball a rolling in reminding us what is diabetes, the types, the things we have to look for, and we go on. So, guys, don't forget pen, paper, and we are live so you can ask your questions. And don't forget, you can also email us at backinmotiontt@yahoo.com to get your questions answered. Don't say you did not have the opportunity. All right, guys? So I'm just about to share our screen, and Ms. Phillip, I ask you to take it away.
Thank you so much, Dr. Stacy. I appreciate it. You know, we all know it's diabetes. We all heard about the term diabetes. But diabetes, as you see on the screen, is just a group of diseases characterized by high blood glucose levels. And that in itself results from defect in insulin production, insulin action, or both. Effects of the diabetes include a long-term damage which could cause dysfunction, a failure to various organs. Now, in diabetes, we also have, just on the screen here, how the insulin works is that the insulin acts as a key actually to unlock the cells so that it opens up the cell so that the sugar could get into the cell for energy. But let me go back. When there is an insulin production, the islets of Langerhans, the beta cells in the islets of Langerhans are damaged. And that is why I said there's an insulin production, defect in insulin production, because the beta cells, they produce insulin. Also, there may be inaction of the insulin or both. Now, we have something like insulin resistance. That's when your cells in your muscles and fat, they do not respond well to the insulin. So the cells in your body are actually unable to take up the insulin from the blood. So in response now, your pancreas have to make more insulin to help the glucose enter the cells so that the cells can use it for energy. And of course, everyone knows there are types of diabetes. So let's look at one, pre-diabetes. Everybody thinks, okay, I have met clients who know they are pre-diabetic and okay, I'm all right, I'm not diabetic, so I am happy. This is a source of concern because in pre-diabetes, blood glucose levels are higher than normal, but not high enough to be diagnosed as diabetes. So pre-diabetes often occurs in persons who already have some insulin resistance. Remember what I said about insulin resistance earlier. So you have to be concerned when you go and you find out that you are pre-diabetic. Okay? The other type of diabetes is type 1. Type 1 diabetes, also known as juvenile diabetes, and let us know that the immune system mistakenly destroys the cells of the pancreas, causing the body itself to produce no insulin. So persons with this type 1 diabetes need artificial insulin daily. And that occurs in children, young adults. And type 2 is when the body does not make enough insulin or use the insulin well. There's another type of insulin called gestational diabetes, diabetes mellitus. And hormones produced by the placenta during pregnancy prevents the body from using the insulin effectively. So, let's
just
look at,
before, as you mentioned, the gestational, Nurse Philip, not to cut the flow, but you mentioned two things that are very important there with regards to one, pre-diabetics, don't rest on your laurels. It means that you have to start paying close attention from the time you have that red flag saying that, hey, something is happening here. And two, I wanted to ask a question, and somebody actually emailed that, as you mentioned, the gestational diabetes, because they said they had gestational diabetes twice with their 2 pregnancies.
Right.
But after that, they will find, do they have a higher risk of developing type 2 diabetes later on?
There is a higher risk, but they will be able to take control of that. Because now that they realize that twice I have gotten pregnant, twice I've had gestational diabetes, it's a red flag for them to know, okay, let me take control now before it becomes it becomes a full-blown type 2 diabetes. So take control from now. You are preventing any more or any cause for the islets of Langerhans to stop producing or reduce the amount of insulin that is being produced.
Good.
Right? And again, you need to take control again, exercise, your diet, the usual that we always preach to people and they sometimes don't do. Okay? So,
And we know
and
about that preaching.
we love to preach, but it's so much more of a commitment for
Yes,
the people. For you, we depend totally on your commitment because we can say everything, but if you are not committed, then we have lost the battle.
correct.
So when we're looking at diagnosis of diabetes, now you go to your healthcare doctor, and the doctor will look at your A1C levels, and many people will ask, doctor, what is my A1C? Why do they ask what is the A1C? No, your red blood cells carry hemoglobin, which carries your oxygen. The glucose molecules stays in the hemoglobin, and over a 3-month period, we will see the heightened amount of blood sugar that was over the 3-month period. And it's reading percentages or milligrams per deciliter. So in a normal person, your A1C percentage will be about 5. As you look at the bottom of the screen there. Your fasting plasma glucose, like if you're fasting, 99 milligrams per deciliter will be low. Even if you take your glucose oral glucose tolerance test, that is taking your glucose, you do a fasting glucose, and then you will also do, after 2 hours, you will drink 75 milligrams of glucose.
Yeah,
And
that thing that tastes so bad. It
yes, yes.
tastes so terrible.
But in pre-diabetes now, the A1C percent is a little above 5, 5.7 to 6.4. And when you are diagnosed as a diabetic, it's 6.5 or above. So that little gap between there, 5.7 to 6.4 pre-diabetes, it's a red flag to know this is the time I must be more stringent in how I am taking care of myself.
Yes.
Okay?
Yes.
And again, I just saying there, it's the average level of blood sugar over the last 3 months.
And it's so important for people to know what their A1C is. Hi, Kathy Ann. Hi, Stephen. Hi, Chantal. Thanks for being on. Because I have so many patients, and we were talking about that before we came on live, who do not know what the A1C is. And they are diabetic for years. They say, well, I know I tested my sugar this morning. It was okay. But you may test it at 8. You ate well. Then you had roti provision, bacon bulgur later on. You didn't check it again because it was good in the morning. And because it was good today, you didn't check it for 5 months. And you have no idea what your control is like. So diabetics, you must know what your A1C is. So you know what your blood sugar control is over the last 3 months. And this Philip has explained what your A1C is. If you have not heard about it before, you're hearing about it now. And if your doctor has not asked you to go for your A1C, at least how many times, Ms. Philip, on average, so should a diabetic do it?
Well, in 3 months' time, your blood cells actually, let's say, for want of a better word, die in 3 months' time. So every 3 months, you have a change in your blood, your blood cells. So that is why every 3 months to do that test.
Yes. You know. Listen well, people. Thank you.
So we also, because you mentioned something about they're taking their test, it is imperative if you're a diabetic, please, I ask, to do a sugar log. What I mean by a sugar log is that every morning you will get up as fasting, because when you go to bed, you're not eating during the course of the night, so you get up fasting, take a blood test, and you write it down. If you do not have, some people say, I could only use the sticks once a day, do it early in the morning before you have something to eat. If you can do it twice a day, do it in the afternoon, or you can do it 2 hours after you've had your breakfast or had your lunch in the afternoon. Now, when you go to your doctor, You can say, doctor, these are my sugar levels. I have tested it every day and I am seeing that it's above, it's this now. Doctor will see now if you are in control or not. It's not just taking it and not writing it down. Have a history that you can see, and the doctor will see, yes, she is in control, she's not in control, she needs to be controlled. Right? So let's get that in mind to always do a blood sugar alert.
Yes.
Right? Now we have some risk factors for diabetes. If you're overweight is one. Definitely. Have a family history of diabetes, 45 years or older. Now we are seeing younger people with type 2 diabetes. Younger people coming on with that, and it is a cause for concern because now with the history, the age of computerized, the technology that is here, people are more sedentary. So it's less activity.
Yes.
And
Yes.
you look at pointing habits. It's easy to get a fast food instead of going to the pot and cook.
Yes.
COVID-19 gave us a little respite, let's say, that some people had no other choice but to cook, which is good. So your body now has to adapt for not having that set of fast food. High blood pressure is another risk factor. High cholesterol, history of PCOS is another risk factor. And we also have the symptoms of diabetes. Now, someone might find that you're going to the toilet very often. The frequent urination, look at that. Look at excessive thirst. Look at you always hungry. You know, and you have weight loss. So what is going on there? Please take note. Something has to be not right. Why am I so? So with the effects of diabetes is heart-rending because heart disease, kidney problems, stroke, nerve disease, blindness, amputation, loss of time from work, time down at work. It's too much. It's a strain on the health system, a strain on the work system, because when you are sick, someone else has to take up the slack. So it's not just a matter of you being affected, but everyone around. If you are affected, your family life is also affected because now your family has to deal with this new disease that you have presented them with. They have to be able to cope with it. And I have to come back again and Dr. Stacy and say the diabetes educator now also helps the family deal with the problem because they talk to the family, they help the family also. So it's not just the person.
I just
yes,
that is so vital. Two things. I'm going to make a comment on that. I think I need to do it. And somebody actually just sent me a question. They're a bit shy via email with regards to something you mentioned. That aspect, that role of the diabetes educator in dealing with the family.
Yes.
There's so many diabetics who don't have the support. So they're trying to, for example, change the way in which they eat. But while you are having your really well-seasoned grilled chicken and broccoli with olive oil and one baked potato, the rest of the crew order KFC.
That's true.
Now, it seems simple, but where is that support for that person with diabetes? And, you know, we have to consider now that we want a healthy lifestyle, whether you're diabetic or not.
That's right.
And so where is that support? When that person, for example, has an amputation, who has to see to the needs of this person where a salary may no longer be coming into the household?
Yes.
Someone who may not have been working may somehow have to find work. They may not be skilled enough to do that, hence the reason they may not have been working in the first place. There's so many facets to it, and it's so vital. And I hope people are taking this information and remembering that if you have not been referred to a diabetes educator, you should be, so that there is a holistic approach to the care of the diabetic patients or the pre-diabetic.
And Dr. Stacy, even though there is family members around, A person with diabetes has to know that there is no perfect, they are not the perfect care. They need to work with the team of people
Yes.
around them. We need to work with the diabetics, not diabetics, need to work with the dietitian, need to work with the doctor, need to work with somebody who can help them exercise, need to work with the family members. Come if they have to reach home by them to let them see, okay, this is what we
Yes.
can do. If you are you have an amputation, show you where or how you can still exercise.
Yes.
So a team has to be working with you. You cannot do it by yourself. It is
Correct.
always best if you have a team. And the last of all, your commitment is what we're looking at.
Yes.
So you are committed,
Yes.
everyone around you is committed. We will try to help the family work with you. And there
Yes.
we'll have everything's going on. Everything will be working in tandem to help you
In tandem.
into a better life.
Yes. And you mentioned something earlier about the risk factors of diabetes, being
Mhm.
overweight being one of them. So I'm not going
Yes.
to tell anybody what my weight is. I'm just going to say I'm voluptuous. But overweight is always a major risk factor for diabetes. But
Yes.
the question the person sent into the via email said, I have always been skinny. So how
Mhm.
come I was diagnosed with diabetes?
Well, remember earlier o'clock I said about the islets of Langerhans, the beta cells. They were not working, let's say for want of a better word, they were not working properly. It does not matter if you are underweight or you're skinny. If those beta cells were damaged, you can't present with diabetes because now you have a low insulin production, low action of the insulin. I have met people or clients that are very skinny and they are diabetics.
Yes.
Mhm. Overweight
I,
now could also
yes.
have a little bit of insulin resistance.
So this
Does
is
that
why
answer
this is
the
why it's
question?
important. And yes, definitely.
Yes.
And I will. I'm not sure if this person who sent this question is viewing, but I will send the response. We have
Yes.
a question, and I'm so excited. It just so happens to be a relative of mine, my one brother, who has
Yes.
made an interesting comment, and I have it up on the screen for everybody to see. When it comes to diet, sometimes I think persons are daunted by the thought that a better diet is tasteless or boring. How can someone with diabetes be encouraged to embrace a new diet? And are there places to go for easy diabetic recipes? Now, we do have a dietitian coming
Mhm.
in on Monday, so I expect all of us to be on Monday, even though Nurse Phillip is also a registered dietitian, but her focus is a bit different today. But can you touch on that though, with regards to this daunting concept of a better diet as being tasteless, and how can they be encouraged to embrace a new diet?
A new diet, it's your, let me just say one thing. Your body and your mind has to get accustomed to changing your lifestyle and the way you are eating.
Yes.
And a new diet does not mean it has to be daunting. You gradually will go into it. It's my humble belief that if you just change drastically, you will not keep up with it. But when
Correct.
we gradually, we take you on that journey and we bring you to that place where you can manage it, that you can eat, you will realize, hey, I could have done this before. Because, okay, let's say you will be eating, you're accustomed eating half of a loaf of bread and you love the fried foods and all of that. Does a dietitian say, stop the loaf of bread completely? Stop the fries completely? She will teach you how to tailor your diet that you will be comfortable in your reduction and your change in the method and the planning of your foods so that you will be happy. She will not just throw you off and say, oh, a bowl full of vegetables here. And no, she will tailor the diet to suit you. And that way you will be able to enjoy it. So it wouldn't be a boring, tasteless diet.
Fantastic.
Yes. Now, in managing your diabetes, exercise is a key component. And there are many ways we have, if you, with the COVID-19 movement, well, people now can go out, but you can stay home, you can YouTube, get some exercises to suit you, and you start a program. Again, if you look at, oh, I want to go and get a treadmill. A treadmill, sorry to say, is an expensive clothes hanger. But if you clear a space in your living room, in your bedroom, and you take a 30-minute exercise every day, you will get accustomed, and then you will start to exercise, and then we start to build. As a diabetes educator, we have something called the FIT program. So it's the type, the frequency of your exercise. So you start up with 30 minutes every day. The frequency, the intensity, you will start walking slowly and then you start to build up. The type, you may be walking, then you start to lift your legs. And the time, you could start at 30 minutes and you could increase the time. So you use that now as you go along that exercise journey, and always encourage your relatives to come in with you to help you along the way. Another thing that you look at is your medication. Now, some people believe, and I have known several people, that when they are feeling good, I do not need to take my medication.
Yes.
And this is wrong. You need to have that blood sugar log. And if you find that your blood sugar is dropping at a low, you find the doctor, let him know. Do not stop taking medication because I am feeling good. It does not mean that your blood sugar could be low or could be normal, because there are many times I have seen clients, I've seen patients where their blood sugar has been very high and they were feeling normal. So it's not taking the medication is not an excuse for saying I am feeling normal. Take the medication as is prescribed by the doctor. He is the one, when you go by him with the log, he will do four things. He will either increase your medication, decrease your medication, change your medication, or stop it. So let the doctor decide what he will be doing with your medication. Another thing, stress levels can also increase your diabetes, your sugar levels. So if there's any stressors that you know, if you have anyone you can talk to help you reduce your stress, it is always better.
Yes.
Okay. So we have a team, which I hope everyone works with: the doctor, the nurse, the dietitian, the diabetes educator or counselor, and your family. Everyone has to be involved in your care. So we have with the diets. Of course, my good, lovely friend, Mrs. Brisbane, the dietitian, she'll be dealing with the dietary management, and limiting your consumption of the unhealthy snacks and foods. She is the one that will advise you and tailor your dietary needs to suit you.
And she'll be on Monday at
On
6:30
Monday,
right here. Yes.
beautiful. And of course, your medication management, of course, is the oral medication or insulin. With you, with the doctor, he'll also, in treating a person with diabetes, there are steps that he will take. You can start with your diet and exercise, diet, exercise, and your oral medication, diet, exercise, oral medication, and insulin, or diet, exercise, oral medication, or insulin, or both. Okay? So just moving along here. Of course,
Before, just a little bit before you, a little bit on this before you go on with regards to the insulin. A lot of times, and sometimes I'm not sure what to tell my own patients. When a doctor prescribes insulin to a type 2 diabetic, they often get very depressed. They think that because they're on insulin, it means that that's the end. They've come to the end of the road, the end of the line. And I know one or two doctors who actually prescribe insulin very early because their belief is that they could get it under control really fast. Then they could go on oral meds. What are your thoughts on the use of insulin, or what can you tell our viewers with regards to having a level of comfort when they are prescribed insulin,
Well,
especially for the type 2 diabetic?
yes. For the type 2 diabetics, one of the fears is injecting yourself. That is the first thing. Now, when the doctor prescribes the insulin, he sees that you need to have that mode of delivery that will help you to carry down your blood sugar levels and get that sugars into the cells for you to get energy. So he has chosen this method. You may not like it. You can ask him if he can change it. If he says, well, I believe this is the best method for you, and when we get your blood sugar under control, then maybe we can change to another mode of delivery, maybe the oral hypoglycemics. So the insulin, it is easy that we have like oranges and we have the needles to show you how to inject yourself. And it's not like you have, it's a small needle. You have also needle syringes. You have the pens. You have the insulin pumps that will give you a certain amount every time that is needed. It's tuned in to deliver a certain amount of insulin to the body. So the method of delivery dependent upon you, what you will be most comfortable with. And also, the diabetes educator could show you, a nurse will show you where you can, if you have to inject yourself, the places that you inject yourself. You have on the arms, the outer aspect of the arms, the legs, both legs, and around your stomach there, around the navel. So you have your sides 1, 2, 3, 4, and then you have around the umbilicus, and then you go back again. So you never will introduce the needle to the same place twice in the same time. So that's another thing that you're being educated about.
Can I give you a joke about insulin? This was not my patient, it was a colleague. And they were wondering, they had a client whose blood sugar was so out of control despite them being prescribed insulin, and they couldn't understand why. So they asked the gentleman one day, this is a colleague in the US, they asked the colleague one day, are you taking your medication? Are you taking the insulin? He said yes. She decided to ask, well, show me what you do. Do you have it on you? Yes. Show me how you take your insulin. He said, I can't. She said, but you have your insulin. He said, I don't have an orange. So she said, what do you mean I don't have an orange? So he was taught how to administer the insulin by using an orange. And he would inject the orange and then eat the orange. And so, and this is a true story. And, you know, I couldn't believe it. And I said to myself, oh, if he was seeing somebody pretty, you know, periodically, that could have been avoided if he had a diabetic educator. True story, folks. These are the things we as healthcare practitioners here, we hear some crazy stories. So that was one. So I just needed to share that insulin story.
Yes, that is true. There are some people, I have known of an 88-year-old woman. She will when I say titrate, that means she will raise her insulin or reduce it to how she feels. So it has people will do these things. You know, 1 minute, if they're feeling good, okay, I will drop the insulin by 2 units, by 3 units. Some people will raise it by 2 units, 3 units, according to how they feel. You know, so it is a bit of concern that they need to stick to what is being prescribed unless it's being changed by the doctor.
Yes.
Yeah. So, of course, you may be plain, you may get up in the morning, have to go to work, forgot to eat, and your blood sugar goes low. So you need to be able to walk with something in your bag, maybe 2 cricks. I don't want to advertise for the crick, but have some cricks or some sweet, that you can pop in the mouth if you know your blood sugar will drop low. If you
Yes.
forgot to take breakfast and have that, so delaying a meal might be a bit tricky
Yes.
because sometimes we in transit, but try to have something that will keep your blood sugar not going too low. Or
Yes.
sometimes they hurry to go and play. Even children, they who are diabetics, you're playing and you forgot clean that the intensity of the exercise that you are doing can cause your blood sugar to go low too. So you have to look out for that. And another
Yes.
thing to make you go hypoglycemic, that is a low blood sugar, is when maybe you tell yourself, okay, I've had too much, and you give yourself too much insulin. So be very aware of that.
Mm-hmm. Thank you.
Yeah.
That is so important. The hypoglycemia in particular is serious, and especially with this heat that we're having, and the need to be hydrated is also important in managing both hypo and hyperglycemia. Yeah.
Yes, 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 yes. So of course the hyperglycemia is the exact opposite. So
Yes.
you have to increase your exercise activity. I remember one in one of the health centers, there was a young girl that came in and her blood sugar was very high. And the dietitian watched the young girl and she says, I need you to go outside and I want you to walk around the health center several times and come back in. And the young girl had to do it. And when
Hmm.
she came back, she tested her blood sugar. It went down.
Yes.
Because now she exercised and used that excess blood sugar for energy. So
Yes.
if that is a simple exercise that we can, a simple method that can be done, we can do it for ourselves,
Yes. And the
right?
great thing is the effect of exercise on blood glucose levels. It is maintained for 12 to 24 hours after you exercise. So
Yes,
if we exercise, as you said, daily, and Dr. Vern Allen, who will be on in a couple of days, she will testify to that in even more detail, the value of exercise, especially with
exercise.
hyperglycemia. Yeah.
Right. Just to note, hypoglycemia, when your blood levels more less than 70 milligrams per deciliter, and hyper is over 200 milligrams per deciliter. Now, just stick a little pin there. There are some people who are diabetics, and if their blood sugar drops below 200 milligrams per deciliter, they get dizzy. We have to know those people and recognize them because they have been operating with that high level of blood sugar that
So
going very
long.
low will be too low for them. Here's where the doctor comes in, and he now will help them to maintain that they will operate at a level that is fit for them.
This, you said that, and I am making notes because there's always something to learn. And I always wonder why my patients, the blood sugar is still elevated, but once it's less than 180, they get dizzy. So I
Yes,
need to, when I identify these patients, I need to send them back to their doctors
yes,
for them to
definitely.
get to be consulted with, because it tells you that the blood sugar has been high so long, the body
That's
can't
right.
even understand what's happening when it goes low.
Yes,
That's amazing. I'm making notes of this.
yes, definitely. Right. Um, I'm looking at your target levels just to make sure that people knows that your fasting blood sugar non-diabetic is 80 to 99 milligrams per deciliter upon waking. Type 1 and type 2, 80 to 130, and even my child, 80 to 130 milligrams per deciliter. So just let them keep those figures in mind.
Yes.
All right. Now I want to come to a special area here of sexual function. And in men, diabetes can cause erectile dysfunction, especially those with type 2 diabetes. Because the diabetes itself damages the blood vessels, which can affect the blood flow in the penis. And of course, all boys, to achieve an erection, they must have a significant blood flow to the penis.
Yes.
Also, to maintain an erection, diabetes can lead to nerve damage. So it's hard to maintain an erection.
Right.
So, men, once you have, it must be in control in order for you to function properly. Not
Yes.
forgetting the woman, The woman, it will, or diabetes will also affect your ability to experience a sexual stimulation and arousal. So even it affects you when you want to release that fluid, that vaginal lubricant, it affects that release. You can have painful sex also, and also because of the bruising and all that, you can have infections, cystitis, urinary tract infections. So we have to be careful. It's not only, it affects every area of the body.
And these are some of the areas that people are so afraid to speak about. They're afraid to go to the doctor and say, well, doc, something going on down there. And there's no need to be afraid, because the only way you're going to manage it is to understand what is happening, why it's happening, and how you can take control. So especially
Right.
in this area, and sex, whether we like it or not, and it's not to be crude, it is a natural part of adult life.
That's
And
true.
you want to enjoy it with your spouse, with your partner. And so we need to get your sugar under control, even if it is just for that, even if that is your main driver in getting under control. And this loss of what people say, you're seeing the books libido, for
That's
example.
right.
Yes, this is fantastic information. Men, women, take it on.
Take control of it, because now when you go to a psychologist, they're not going to laugh at you. They're not going to ridicule you. They know that you have a problem. We have to help you fix that problem. And sometimes stresses and all could cause the men to have some sexual dysfunction. So
That's right.
manage your stress area, stressors too. But please seek help if you know that you are having any problems. We are here to help, not to ridicule. And one other thing I'd like to,
Philip, before you go into the foot care,
yeah,
before you go into the foot care, I just want to show you this comments from the Diabetes Association of Trinidad and Tobago, who said this is a great initiative, and I have their support. And I have to say thank you to the Diabetes Association for the work they continue to do. And anybody who's listening now, if you are not a member of the Diabetes Association and you're diabetic, or you have a friend or relative who's diabetic, you should become a member because of the fantastic work they're doing. And Andrew Danu, who will be our final guest for this, I have to say it now that this would not be possible without people like Nurse Philip, who have given their time for free. They have not charged me a cent. Hopefully we will get sponsors eventually so that I can give these people who are using their time at least a stipend for this information that normally you'll have to pay for in spades. So thank you to the Diabetes Association for acknowledging this initiative, and thank you for Nurse Wendy, Philip, and all the other guests who are soon to come. I had to put it up there, and I didn't expect them to comment, and they have, so that is a testament not to me but to the presentation that you are doing. So thank you so much. I know you're going to go into the foot care, but I had to do that segue.
yes. Yes, but I love people. We have to be aware that your foot care is most important. Now, with COVID-19 here, and Dr. Rowley has so kindly opened up the beaches for us. Be very aware of when you're walking on those sandy beaches. In fact, over time, it can destroy this blood glucose, destroys the small vessels in the foot, in the body, and also that supplies the nerves, and you have loss of feeling, tingling, numbness, loss of ability to feel pain, to detect the changes in temperature, loss of coordination. Over a time, the nerve fibers become damaged and they disappear. So, caring of the diabetic foot, first you're looking at your footwear. Your shoes must fit properly, not tight over the digits, but always have room in the digits. If you have to go and buy a new pair of shoes, do it in the evening when you are finished work, because that's the time when your foot is at it's swollen at its biggest. And break those shoes in gently. Okay? Never walk barefooted, and inspect the shoes inside for any edges, rough or internal edges that or objects. And when you're looking at your caring of your feet, no, there's some people may be challenged if they are, let me say, overweight. So ask your relative to check your feet daily, on top, the sides, the heels, between the toes, even any discoloration, any change in temperature, whether the discoloration by seeing a little white, something could be in, feel the foot to feel there's any change, any bumps or bruises, something could have been embedded there. Yes. So feel, make sure that you inspect the foot thoroughly. Wash your feet with warm water and mild soap and dry thoroughly, especially between the toes. Sometimes we tend to use strong soaps, it could damage the skin. Even you have to test your temperature of the water before immersing it in, please test the temperature. Use your elbow, use your hand, because you may not be able to test the temperature with your foot, feel the temperature. Also, one specific thing, when drying the foot, especially between the toes, make sure it is dry, because there's a high risk for infections when there's a moist area. You can also, because of the changing in the skin, apply some nice oils to the skin, but never between the toes. Always keep them dry, right? Because feet become dry and they crack, potentially giving an infection or causing an infection.
Yes.
Yeah. So, no, normally some people might want to feel the heat. They want to apply heat pads. Be careful with that. And as I said, the hot sandy beaches right now, that we can go in drones of tens.
Yes.
Please do not walk barefooted on the sandy beaches. And if your foot feeling cold, please wear a sock in bed.
Yes.
But I know Dr. Vern will have a lot more to say about the care of the foot, because she is doing wound management.
Yes.
Yeah. So, again, any questions on your foot care, Dr. Stacy?
Not at this point, but
Beautiful.
Just a reminder, as you said, the beaches are opening up, so let us practice due diligence, especially if you're diabetic, and wear your flip-flops while you're on the sand.
Yes, beautiful.
Thanks to the Honorable Dr. Rowley for allowing us to go to the beaches again.
Thank you again. Oh, yes. Well, of course, with physical activity, we know that we must be active. Have extra carbohydrates or Gatorade. If you know you're going to be excising excessive, have something sweetened on the side. Check your glucose level before, during, and after the activity.
Yes.
Not just before, but during and after. You can know if your blood sugar is going low, right? And of course, we know, as I said before, it will decrease your blood glucose level. So it may fall too low, so please check to know what is going on there with you, right? And have a snack with you. Carry some, maybe if you have glucose tablets, fruit juices, and your medication. If you has not, some people really do not like to take their medication on time.
Yes.
So have medications should, in case you go hypoglycemic or you know what to do, right? So this is the end of my presentation again, and I want to ask any more questions that I can deal with.
So I am going to just bring us on screen, both of us. Yes. And again, thank you for that, because it's difficult to speak about diabetes in a way that persons can understand. And you have done that, I think, exceedingly well.
Thank you.
And Rosalind Jackson has said good night, and she's agreed with me. I'm just seeing her comments that you made it easy for persons to understand. And I think this is vital, because again, sometimes we go into the doctor's office. I'm not hitting on the doctors, but it's just the reality. And sometimes they speak to us in the language of the doctor. And we shake our heads, and yes, we understand, and we leave having no increased knowledge. And you have presented this in a way for us to understand. And I want to commend you for that and thank you for that. You brought it down to brass tacks. And it's so much information that you concisely put together for us in less than an hour. So I'm very grateful for that information. But there's one thing that I wanted to touch on very briefly. And it's this talk about comorbidities with regards to COVID-19. And everybody is on this, patients died, but they had comorbidities. And I think I read the news that yesterday, quite sadly, a teenager passed. And I think they were diabetic. I think they were type 1 diabetic because of COVID-19. Why are diabetics and persons with other comorbidities more susceptible to
To the
acquiring
COVID-19 virus.
COVID-19? Yes, yes.
Yes.
And,
The
and, and,
COVID,
other, and other viruses.
yes, well, the comorbidity is existing conditions independent of themselves, but existing together in the body, like diabetes, hypertension, even some cancers. You have other conditions existing, even though they can be independent of each other, but existing together. With this, your immune system now has been decreased, has been compromised, because here you are on medications, your whole lifestyle, you have been compromised. So it's easier for you to acquire a virus. A virus could take over the body. So the compromise is what we are looking at. So in order to, you have to build your immune system, take care of yourself. And again, with the dietitian, she can give you foods to help you build your immunity, even in your state, so that you will be protected against the viruses that may come your way. The common cold, COVID-19, whatever. Work with the dietitian. Here is where the foods will help build your immunity.
And again, for us to be able to fight it, it means we have to build that immunity and have better diabetic control, blood glucose control.
Yes.
So again, at the end of the day, it all comes to control and of being the main part of the team. So I just to recap some really salient pieces of information. And Marsha Forrester, thank you so much that you've appreciated this information. Laura Hall, thank you so much for your comments. Ms. Philip Laura said, great presentation. The information was simple and easy to understand, and she enjoyed your style of presentation. So I think
thank you so much, Laura.
Yeah, I think y'all are just cementing that I made the right choice in asking Ms. Philip, and for her to say yes, I'm very grateful. So I just want us to recap very important things, that yes, we have different types of diabetes, type 1, type 2, gestational, and pre-diabetes.
Yes.
Even when you're pre-diabetic, that's a red flag. We have to start looking at things, because you're already in an insulin resistant sort of mode. So the risk of you becoming full-blown diabetic is much higher. So even though you may feel comfortable that you're not diabetic, you can become, your risk are higher. So commit with, even though you're pre-diabetic, type 1, type 2 gestational, commit to making the necessary changes. And some of these things are not huge changes. They are incremental, but your commitment is necessary. You must know what your A1Cs are. That is that percentage that tells you what your blood sugar control has been over a period of 3 months or so.
3 months,
So
yes.
if you have not done yours in a while, if your doctor hasn't sent you, you are part of the team, not the doctor. You are the main part of the team. Say, doc, send me for my bloods now. It's time for me to check my A1C. All right? Very important. Keep a sugar log. These are the small pieces of advice that can change the complexion of your disease. If you keep a sugar log, you have a better idea, for example, of what food may cause your sugar to spike. Because I may have watermelon and it doesn't bother me, but somebody else eats it and the sugar goes way out of control. It also allows you to go to your doctor with pertinent information so that they can make better decisions in deciding what advice and what medical and medicinal care that you would need. All right. So keep every diabetic from now on, even though you may be controlled, we have to have proof of that control. Keep your sugar log. All right. Remember that there are certain ways to manage the condition, including diet. We have our dietitian coming in on Monday, so I hope to see all of you there to speak in more detail about your diet. about learning if there's a special diet for diabetes or if there isn't. We'll discuss that. Exercise is key. The average amount of exercise that is advised is 30 minutes of exercise a day. And Dr. Allen, our physiotherapist, will also be touching on exercise and knowing that no matter what condition you are in, you may have an amputation, you may be visually impaired, there's always some form of exercise that you can do.
Yes.
And that will be discussed. The appropriate use of your medication. Don't self-medicate to suit you. The doctor has prescribed certain things to you based on your sugar log, based on your sugar levels. So if you are noticing certain issues, go back to your doctor, have a discussion before you change your meds to suit you, because you are doing yourself an injustice. You may be causing more harm than good.
Good.
And remember, we have to manage our stress. Some of us manage our stress by stress eating. Some of us manage our stress by just sitting in front and Netflixing and chilling. And we do a lot of that during COVID. And because of COVID-19, many of us are working from home. So we are sitting for such longer periods of time. So we need to find ways to manage our stress, to get the exercise in, to make proper dietary changes, and to use our medications appropriately. I am so happy that Nurse Phillips mentioned the sexual dysfunction. Do not be silent on these so-called personal issues. That is an important part of life that can be well managed if you talk about it. All right? Foot care. We're going back to the beaches. Wear your flip-flops. Be mindful of temperatures. Ensure that you wear proper fitting shoes. Notice any change and inspect your feet daily. I learned from a patient a number of years ago, and that's the beauty of it. We learn from each other. Our role is not just to teach the patients. Our role is to learn as well and go along that journey with the patient. And I never forgot a patient who lost one leg, said from then on, he started to advise his friends who are diabetic to wear white socks. Because sometimes, because the diabetes damage the nerves so badly that they may not feel a difference in the foot. But when they wear white socks, they can see, wait, my foot is bleeding, there's a wound. So these little things can help so much in preserving your limbs. And don't forget to prepare a kit to treat low blood sugar or hypoglycemia, especially persons working from home. You're skipping meals. Some people think that is the way to address their food intake by skipping meals, and you shouldn't, but things happen. So prepare a kit, have a kit. I don't want anybody diabetic to ask the neighbor or to ask the daughter or son, you have a sweetie in your bag? No. You're supposed to have your Cricks, a small chocolate bar, some mints, an apple in your kit that is always on you wherever you go. So again, I am so excited, so happy that we've had this evening with you. We've tried to keep it an hour. We don't want to overstimulate your brain. Feel free to send any questions to backinmotiontt@yahoo.com that I could send it to Nurse Wendy for you. And Nurse Wendy, can you please give us your contact information for anybody who may want to have a consultation with you?
Yes. My contact is 476-4559. And also my email address.
Yes.
WJPHILLIP07@gmail.com.
So I'm going to post this information on my Facebook pages, both the Back in Motion Physical Therapy Services page, as well as my personal Stacy DeGale Facebook page, so that we can consult. Now, she gave you her cell number. Please be judicious in its use. Don't call her too late at night. She has to do her stress management and rest. So call within or message, WhatsApp, within working hours, 8 to 4, and she will respond to you. And if you have any further questions or anything that you did not get answered on today's show, just email us again. at backinmotiontt@yahoo.com, and we will do our utmost best to see to the questions that you have asked as we journey together on this wellness train. We have no trains here, but we want something fast, the wellness train or the wellness Concorde, to ensure that we can continue living well with diabetes. So thank you to everybody who has tuned in. Spread the news, share this recording. We're on YouTube as well. Thank you again, Nurse Wendy Phillip. Thank you, Alex, for lending me your mom. I'm very grateful for that. And that was Alex, people. And thank you for the support from all of you who have been here, and to the Diabetes Association, who will be doing a host of activities throughout the month of November. You can tune into my page as well as the Diabetes Association Trinidad and Tobago's Facebook page and website to learn more as to all the activities, including free eye screenings that will be happening, as well as in my clinic in Point Fortin. So just tune in to get more information. Be a part of. We can take control, and we urge you to take control as we help you to get on the road to wellness, as we living well with diabetes. So folks, have a fantastic night. And again, thanks to all of you. And we will see you right here at 6:30 on next Monday to have even more intimate discussion with our dietitian, Tracy Brisbane Jackson, on what we could eat, what we can't eat in the Caribbean kitchen. And all you know what our Caribbean kitchen looks like. So thanks, guys. Take care and have a wonderful night. Bye.
Bye-bye.